Good evening, good afternoon, and good morning. This is the 1352nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. RANJITA Gupta. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. We have doctors as well as eminent personalities from different parts of the world has presented so many papers on different subjects in this session. We have 3 sessions in a row that as you just completed our Hindi session from 7 to 8 and 8 to 9, the international session in English, and 9 to 10 a local language session in Malayalam daily. And we are very happy to say that all these sessions are really excellent. It is being uploading every day, every next day itself, so that those who misses the session can also watch again and again. And you can subscribe it without paying any amount. Not only that, you can share with your friends so that homeopathy will be the winner. Our aim is to make homeopathy the #1 in the world. And for that, we are doing this much of things to promote homeopathy. And today, as you know, Dr. RANJITA Gupta has completed her MD in Organon of Medicine, and she is working as an assistant professor, Department of Community Medicine, Paul Institute of Homeopathy and Research, Paul University, Vadodara, Gujarat. And she had presented poster presentation in All India Homeopathic PG seminar in 2020 held at Calcutta, and published articles in various national and international journals, runs IFPH preparatory classes for undergraduate students since last 1 year, and she had 5 years of clinical experience in the field of homeopathy. And today she will be discussing about one excellent subject, that the mind-gut connection, a homeopathic approach to well-being. So let us proudly welcome the guest of the day, Dr. RANJITA Gupta. Welcome. She has joined. I have made her the co-host.
Your speaker has joined. RANJITA Gupta has joined already.
Yes, sir.
You can. Yeah.
Shall I share my slides, sir?
Yes.
Okay, sir.
Yes.
Okay.
Yes, fine.
Thank you, sir, for the introduction and for the warm welcome. Am I audible?
Yes, yeah. Everything fine. Yeah.
Okay, sir. Okay. So, good evening, everyone. Today, my topic of presentation is mind-gut connection, a homeopathic approach to well-being. So, before I'll start my presentation, I would like to give a brief overview what I'll be sharing in my today's presentation. So basically, I'll be talking regarding gut-brain axis, how the gut and brain is connected or correlated with each other. Next, I'll be talking regarding microbiota, and especially out here, I'll be talking regarding gut microbiota. I'll be talking regarding bowel flora in health, how they function, and if there is any alteration of bowel flora, what diseases they can cause, that I'll be talking. And plus, I'll be talking homeopathic implication, like how homeopathically we can help in such situation. And I'll be sharing one of my case also. So we know that whether we are a new one, beginners, or the experienced one. If we are going for any public speaking, if we are going for any important interview, or if we are going for any examination, we used to suffer from some kind of symptoms, like we used to suffer from nervousness, we will have anxiety, fear, and because of that, even we tend to suffer from GI disorders like diarrhea, vomiting, nausea, many more. And this is what? This is nothing but the mind-gut connection that delves into the fascinating relationship between our gut and brain, and also the profound significance of our gut microbiome and its impact on our emotions, decision, and overall well-being. So we can see in this diagram, we can see in this picture, we can see there is a triangle, and it is a triangle of our brain, of our gut, and plus of our microbiome or microbiota. So what this triangle wants to say is that they are correlated with each other. For example, if there is any alteration in our gut, the gut microbiota, they get altered. As a result, we'll have some mental symptoms. And if there is any mental symptoms, take it along continuous stress or any other mental symptoms, the gut biota, it gets altered and we have a symptoms, GI symptoms. So this is what they try to show, the gut, brain and gut microbiota triangle. So the impact of our gut on our health is increasingly in the modern times. The relation between our bodies and our stomachs, it is becoming a subject of daily discovery. So the gut-brain axis, the connection, I will say the connection between the gut and our brain is the most important and unexpected connection we can say. Even there is one of the sayings of Hippocrates also, that he has quoted one line, that every illness starts in the gut. So now what is this gut-brain axis? What is this gut-brain axis, or how does this gut-brain axis works? So before telling what gut-brain axis is, that I just want to give a brief history how this gut-brain axis got discovered. So it was early 1800. It was during the time of 1800s. What happened? There was a surgeon. He was an army surgeon named William Beaumont. What he did, he treated one Canadian, and the Canadian was accidentally shot at a close range. He was shot. So after the surgery, what happened? There was a hole. The surgery left a hole in his stomach. Now, what surgeon? What he thought? He thought of doing experiment on that. And what he did, that by inserting food in his stomach, he started recording that how the gastric juice broke down the food. So what he noted after the experiment, he noted that if there is any irritability, uneasiness, anger, if the Canadian, if he is suffering from any uneasiness, irritability, anger, what is happening? The rate of digestion was changing. So this was one of the first medical notes which was saying that yes, there is a connection between our gut and brain. So now, what is this gut-brain axis? What does it mean, or how does it's working in our body? So no, gut-brain axis, it consists of bidirectional communication between the central nervous system and enteric nervous system, that linking our emotional, cognitive centers of our brain with the intestinal functions. So this interaction between microbiota and GBA appears to be the bidirectional communication, that is mainly a communication from gut to brain and from brain to gut. So what happens? The signals from gut microbiota to the brain and from brain to gut microbiota, it used to occur via different links, and mostly the links are it can occur through neural, endocrine, immune, and humoral links. So in this picture, in this diagram, we can see that how this gut-brain axis is working, or how the gut-brain axis works, why they are connected with each other, or how they are connected with each other. So we have the central nervous system, and in this central nervous system, particularly this hypothalamus, pituitary and adrenal axis, that is HPA axis. What happens? It gets activated. It gets activated because of some because of factors like, we can take it, emotional stress or any anxiety, I will say. So what happens? It gets activated. Now, because the axis get activated, this our hypothalamus, it secretes CFR, that is corticotropin releasing factor. This CFR, right? This CFR, it will go and affect our pituitary, and it will act our pituitary. When it will act in our pituitary, it will secrete ACTH. Now, this ACTH, what it will do? It will go and act in our adrenal gland, and as a result, it will produce cortisol. Now, cortisol, we know this is a stress hormone, right? So what happens? This cortisol, it will affect our intestinal targets. So what happens? It alter our gut microbiota. And because if there is a alteration of gut microbiota, a condition in the gut is produced, and the condition we call it as a dysbiosis. This I will discuss in upcoming slides. So parallelly, one path, this is happening, the HPO axis, and at the same time, what is happening is that the central nervous system, it communicates with our intestine, and it communicates via different afferent and efferent autonomic pathways. So when they communicates, when they communicates, when the central nervous system, it communicates with intestinal targets, what happen? It show effect on different portions of intestine, I can say. Like it can affect it communicates with our ENS, that is enteric nervous system. It affects our muscular layer, and plus it affects our microbiota. Now all these things, this ENS, muscular layer, microbiota, what they normally do, they used to modulate our intestinal motility, they used to even permeability, and plus in mucus secretion also. So this is how our gut-brain axis works, or our gut-brain structures is working. So the central nervous system, it can communicate with enteric nervous system, and it affects a different aspects behavior, including the gut mucosa, muscle, intestinal lining, mucus release. On the other hand, it is the central nervous system, it is showing its effect on GI system, whereas on the other hand, when the organ of GI system, gastrointestinal systems are inflamed, irritated, or if we experience pain, what they can do? They can send a signal to the brain, which mainly what they can do? They can mainly affect our cognition, emotion, and mood. So when as I am talking regarding microbiome, as I am talking regarding microbiota. Now, what is this microbiota? I just want to explain in a brief. So, this microbiome, it refers to the microorganism and the gene they carry, whereas microbiota, it refers to the microbes themselves. Now, this microbiota, if we want to know the origin, right? If you want to date the origin, this microbiota can be dated back early 1900, and it was found that there is vast number of microorganisms in our human body, including bacteria, yeast, viruses. They coexist in our body, and we can get this microorganism in our gut, in skin, in lung, and in oral cavity. When this microorganism we get in the human gut, we call it as a gut microbiota. And there are trillions of microbes in a human gut. And if we'll try to measure, right, if we'll try to measure this microbiota, there is around 1 to 2 kg of bacteria we can find in the adult human gut. So this gut microbiota, there are two types of gut microbiota. One is the good one and another one is the bad one. The good one, we call it as a symbionts, commensals, and the bad one, we call it as a pathobionts. So what normally happens, they are in harmony with each other, like they used to stay in harmony, and they produce, what we can call this situation as a symbiosis. So the good microbiomes, the symbionts is basically a probiotic bacteria, and this probiotic bacteria is that bacteria, even we can take it in the form of diet also, that I'll discuss in the last of my presentation, that what diets can be used to give a probiotic bacteria. So this probiotic bacteria, it is defined by the WHO as a living organism. When it is administered in an adequate amount, it can give a benefit health to the host. So normally what happens, that if there is any alteration of this gut microbiota, the good ones, the symbionts, it will decrease, that we can see out here, right? It will decrease, and the pathobionts, it will, if the bad bacteria are increasing and the good microbes are decreasing, it will produce a condition in our gut that we call it as a gut biosis, which we just saw in the gut GBA axis. And because of this biosis, it can produce multiple disease condition, right? It can be in place of mental plane also. It can be in place of GI plane, in our gastrointestine also. The diseases I'll just say in upcoming slide. So the main things what this bowel flora, microbiota, they are doing in our body is that firstly, they are staying in harmony with the system, right? Apart from that, they help us to digest the complex carbohydrate, fibers, xenobiotics by breaking them down. Plus, it will help in the development and homeostasis of the immune system. Apart from it, what they do, they protect us against the pathogen. And the most importantly, what functions they perform is that there is a constant flow of information, right? There is a constant flow of information from our gut to brain, and that is mainly via vagus nerve and its branches. Now, what happens? This information allows these microbes to keep track of our emotional state, our stress level, and our circadian rhythms. So this is what I want to summarize, that what in healthy condition, what roles bowel flora wants to play. So what it is doing, that there is an exclusion of exogenous pathogens, there is development of immune system, tissue, and even it helps in differentiation and development of the tissue and organ. It helps in the development of the nutritional capabilities. There is provision of the nutrition. There is provision of the vitamins. It helps in the detoxification of harmful dietary constituents. Even it's good, if our bowel flora, if they are in healthy condition, it helps in the prevention of bowel cancer also. And plus, it plays a vital role in the development of the complete immune system. Now, if our gut is healthy, right? If your gut is healthy, the following symptoms we can see. This all we know. So what symptoms we can see if the gut is healthy? There will be regular and pain-free bowel movements. There will be consistent energy. There will be normal amount of gas and bloating. There will be healthy bowel transit time. There will be mental clarity. Yes. And there will be healthy reaction to the food and the stress. Now we'll talk what happens. What if this bowel flora is altered? Bowel flora is altered, and what condition, in what condition they produce diseases, the various diseases, right, which we can see in this slide. So apart from GI, apart from its affection on gastrointestinal tract, apart from its affection on our mental plane, it can show its effect on different system of our body also. So what happens is that when they are subjected to external change, now this external change can be in of any form, like if there is any imbalanced diet or improper diet, improper food we are taking, right? And I guess this right now we are fond of everyone, the even the adolescent teenager, they are fond of the junk foods. They prefer pizza, burger. So what happens is that this type of diet, right? This type of diet, it will alter our bowel flora. So it is going to affect our bowel flora. Apart from the diet, if there is any continued, long continuous stress, emotions, any emotional disturbance, long continuous stress, any, just a minute. Okay. Sorry. So I'll continue. So if there is like one thing external change I said regarding the improper diet, right? And the next was if there is a long continuous stress, any other emotional factor, right? If there is grief, and plus apart from that, if there is inflammation of our gut, what happens? There will be the imbalance. The imbalance occur in this microbiota. So if what they do, when there is an imbalance, right? If there is an imbalance in the gut microbiota, so they produce a condition which I said earlier also, that is a dysbiosis. So this dysbiosis, what it is causing? It is causing many disease, like it can cause IBS, it can cause IBD, and if we'll see the brain disorder, this imbalance is even responsible for Parkinsonism, Alzheimer's, and depression also. And apart from these two, plain, we can see it can have effect on heart symptom, heart disease also. It can have effect on cancer, respiratory disease, diabetes, right, liver. Okay. So today I'll be focusing in our gut-brain axis only. So what happens? Next, this slide, I just want everyone to please draw your attention in this slide. So this slide is basically, it's showing a relation or a reaction when we encountered a different type of emotions in our life, right? So in our life, we encountered with different reactions. There can be sometimes there will be fear, there will be anger, there will be sadness. So in response to this situation, what our gut responds, what our gut will respond, this I want to say in this slide. And plus how homeopathically, right, in how homeopathically in such situation we can help. This one also, this is also I'll be talking. So we can see, right, we have a upper GI tract, this one upper GI tract and the lower GI tract. So what happens in case of fear? Okay, in case of fear, the signal which is sending from gut to brain is mainly via vagus now, which I said already. So what is happening in case of fear? In case of fear, in upper GI tract, there will be hypoactivity. This down arrow, it is showing hypoactivity. There will be hypoactivity of upper GI tract. As a result, the person will feel noxious and he will feel like she'll get the symptoms of, he or she, they will get a symptom of vomiting. Whereas in case of lower GI tract, there is hyperactivity of lower GI tract. As a result, what happens? The person, there will be a hyperperistalsis of the rectum, and the person will feel that he or she will get diarrhea. So what we are getting in case of fear, normally what symptoms we get? We get either nausea, vomiting, or we get diarrhea. So in case of anger, now, in case of anger, what will happen? Both our upper GI tract and the lower GI tract, both of these, right? There will be hyperactivity of both upper GI tract and lower GI tract. So what happens if there is a hyperactivity of upper GI tract? The person will feel there will be a much acid secretion, and the person will suffer from acidity. And if there is hyperactivity of lower GI tract, there will be diarrhea. So in case of anger, basically what persons they counter, what symptoms they counter either acidity, and plus they can counter diarrhea also, right? Now, in case of sadness, what is happening? There is hypoactivity of both upper and lower GI tract, So because of hypoactivity of upper GI tract, the person will suffer from vomiting, and because of hypoactivity of lower GI tract, the person, they will suffer from constipation. So in case of sadness, the person, they will encounter either vomiting or constipation. This image, this reaction of fear, anger, sadness, it has been beautifully explained in the book of Emmer Mayer, that is the mind and gut connection. Now, we know, right? We know in homeopathy that we have a symptoms. We have in our Materia Medica, in our repertory, we have the symptoms that because of fear, this is happening. Because of anger, this is happening. Because of sadness, this is happening. Or because of melancholy, mortification, many other symptoms we have in our Materia Medica and plus in our repertory. And I guess this is the best advantage for the homeopaths, a boon for the homeopaths, that this type of condition, this kind of situation, we can treat it very nicely. And I guess this type of condition in, if I talk about other pathies, we have an advantage over such situation because of the plenty of medicines and plenty of situations. For example, in case of fear, we know medicines like, we can think if there is a fear and if the symptoms, this type of symptom is producing, right? So we can think of medicine like argentum, nitricum, gelsemium, califos. Even califos, we use it as a examination, brain fag, examination fung, opium, pulsatilla. We can use this medicine, and plus antium tart. And plus, apart from this, we can use even digitalis chelidonium also, as these two medicine, it has been nicely given in our repertory, right? So these are the medicine we can think in such type of situation. Now, if we'll come to anger, in case of anger, what we can think? We can think if these symptoms are producing, we can think of the medicine like Ipica, Nux vomica, Chamomilla, right? So these are the medicine we can think. And in case of sadness, if these symptoms are producing, these are the symptoms, if the patient is showing these symptoms, so we can think of medicines like Natramur, Staph, Nux vomica, Platina. Sir, just a query. Is my slide is moving? Is it visible? Actually, I am getting in comment box that my slide is not moving. Is it okay? Is it okay, my slide? Is it visible, sir? Okay, then I'll proceed. So, such situation. So, just in such situation.
Madam, everything fine.
Okay, sir. Okay. Okay, sir. Okay, sir. Okay. So, in such situation, we can give a very good help. Our medicine can be very beneficial. Now, as I am talking regarding this microbiota, microbes, so from where the dose of microbiota, the dose of microbiota we are getting in our early stage of life. And I guess this information, it will be very helpful. It will be helpful in terms of our case taking. As we know in homeopathy, our past history, right, intrauterine life, gynecological and obstetric history is very important. And I guess these all things will help in our case taking. So what happens? What happens if there is a normal delivery? If a child is born through a normal delivery, that is vaginal delivery, he or she, the child will engulfs the vaginal flora during the process of delivery. So as soon as they engulfs vaginal flora, what happens? The colonization of gastrointestinal tract of the newborn start, and it starts immediately after their birth. So this process, the process of transferring this vaginal flora to the baby's digestive system, and that is basically during the process of vaginal delivery. This is the first microbes, the first dose of microbes the child used to get. And apart from it, if the child is feeding a mother's milk, if mother is doing breastfeeding, what happens? This microbes, the colonization will further occur, right? The colonization will further occur, and in this fashion, what happens? The microbes they get further developed in our body, in a child. So suppose if the child is born by a C-section, or suppose if the child is getting bottled milk or any other artificial way of feeding, this microbes which the child normally used to get through vaginal delivery, through breast milking, through breastfeeding, they are normally devoid of. So, study has shown that if they are born through C-section, or if they are bottle feed, there are many articles on this also. The child is bottle feed, or if they are born via C-section, they tend to suffer from GI disorder. Comparatively, the suffering of this child is more as compared to the normal delivery child. Apart from this, study have also shown that the mother who is continually exposed to the stress, this we know that if the mother is continually exposed to the stress during her pregnancy, or during the time of delivery, right, what happens? This stress, again what it do, it alter the vaginal flora, and the quality and quantity of these microbes is not so good, I can say, or not so appropriate as compared to the mother who is normally healthy mother, as compared to the stressed mother. So what I want to say regarding this, I would like to make it more clear via this picture, right? What I just said regarding the vaginal delivery, regarding the breastfeeding, right? So we can see in this that a building is like, if we are constructing a building, and if the base of the building is not strong, or if the material that has been used for making the building is not strong, in future it will collapse, right? Similarly, what happens that if the base of the child is not strong, it can lead to the various diseases. So what happens if the child is born through either C-section, right? And there are various articles, right? In PubMed, we can get various articles regarding the cesarean section, vaginal delivery child, gut microbiota, relation of all these things we can get. So what the article is saying, what the study is saying, that if the child is born through C-section, or if the child is bottle fed, or if it is born through a stressed out mother, what happens? The microbiota, the microbes, they get altered. So there will be a low diversity of microbes as compared to the normal baby, the baby who is born normally. normal vaginal virility. And if there is a low diversity of this microbiota in children, what it can cause? It can cause a various neurodevelopmental disorder like IBS, anxiety, autism, and even we get that in a autistic patient, we even see in our clinic also, right? They tend to suffer from GI disorder more. And this is one of the reasons as their gut microbes are altered, right? Gut microbes are altered, so they tend to suffer from GI disorder more. Whereas in this condition we see normally in childhood, right? Whereas in older days, if there is a low diversity of the microbiota in old age, it can produce a disease condition, right? That is neurodegenerative disorders. So it can cause Parkinsonism, Alzheimer's. So this Parkinsonism, Alzheimer's, these are also, I will say, one of the factors of causing this disease can also be the altered gut microbes, right? So we can say that if this bowel flora, when it is irritated, altered, or not proper, it can cause deterioration of our health, either it is in mental plane or it is in physical plane. Now, homeopathic implication, like I would like to talk now how we can manage such cases, how we can help them homeopathically, how we can manage if we are facing this type of problem in our day-to-day practice or in our clinics also. So before going to this implication, I just want to say one story or one of the provings, right? That is from our field only, right? This is from our homeopathic field only. And these symptoms or these writings, what it suggests that even our symptoms is also saying, yes, there is a connection between a brain, our mind, and a gut. So what happened is that it was J.C. Morgan, right? What he was doing? He was doing proving of gelsemium, right? And after 2 weeks of proving, what he found that uh, so many symptoms of gelsemium he recorded, and what he did, he published these symptoms. And one of the symptoms of gelsemium, what he published was that because of depression, there was diarrhea. The depressing emotion, just a minute, produce a tendency to direct disturbance of the intestinal canal. So what happened after a few days, Morgan, a old gentleman, he came from Philadelphia. He came to the Morgan residency, just to inquire one symptom. And the one symptom was depression was causing diarrhea. So he started asking that how he did the proving, what was the method of proving, what was the exact sensation, what was the circumstances where he did the proving, right? And later on, what Morgan, he realized that later on the person, the old man who came to inquire regarding this symptom was none other than Constantine Herring, right? So he traveled a long way just to confirm one symptom of gelsemium, right? That is because of depression, it is causing diarrhea. So after re-verification, what Herring did, he started re-verifying these symptoms and reconfirming these symptoms. And after re-verification and reconfirmation, he made these symptoms as a keynote of the drug gelsemium. And the symptom was because of depression, there was a diarrhea. So the symptom is also saying that gut and our brain and gut is connected. Okay, so now I'll be discussing regarding the repertorial analysis, right? What medicine we can think of. We know some medicine we already know, like we know regarding argentum, gelsemium, all this medicine we already know. But apart from this, what medicine we can think in such situations, like So I have taken NAR repertory because NAR repertory we used to use it, and we have find it. I have found a beneficial effect also. And main purpose of using NAR repertory is that it is a Puritan repertory. It is in the language of the prover. So we can think. So if you see these rubrics and all, right? If there is a anorexia after fright, we can think of ignatia, right? And if there is an anxious feeling in abdomen, anxiety after a supper, evening meal, we can think of argentum nitricum. Fullness, discomfort, distress after, we can think iodine. Iodine is very good in such conditions. Uranium nitricum, rhododendron, aconite. Apart from iodine, we can think of other medicines also, right? If there is nausea, nausea because of anguishness, we can think of digitalis. If there is anxiety, right, anxiety is producing nausea. We have agaricus. Apart from the known medicine, we can think of agaricus, calcarea, sabina. If there is nausea during anxiety, right, if the during anxiety we are having nausea, we can think of chelidonia. Nausea along with diarrhea, right, we can think with the antium tart. And if there is depression, depression is causing nausea, we can think of agaricus, ignatia. So apart from ignatia, matrimure, we can think of agaricus and digitalis also. If the nausea is from emotion, we can think of calicar. If there is a vomiting, right, vomiting due to some condition like from anger, after anger, if there is a vomiting, we can think of chamomilla, nox vomica. If there is anger, if there is a vomiting after anger with indignation, we can think of colocin. If there is any ill humor behavior, ill humor after we are facing vomiting, we can think of cyclamen. If there is with nervousness, vomiting with nervousness and with depression, we can think of Portulus horridus, right? If the vomiting with nervous excitement, if there is a nervous excitement, we can think of Buforana, right? Anguishness, because of anguishness, flatulency is there. We can think of Nux vomica. This we know already, right? And because of nervous disorder, worms and all, the Sina we know, this medicine Sina we know. And other medicine which we can think of is Sabadilla and Spigilla. So apart in rectum, yes, in rectum, if there is a constipation, right? Constipation after dejected feeling, we can think of Calcarea fos, Chelidonium, Graphitis. If there is a constipation from fright or fear, is this one opium we can think of. If there is constipation because of melancholy, right, we can think of Platina, very good medicine for constipation after melancholy. Oleander, if there is constipation after nervous excitability, we can think of isostigma, right? Apart from the NAR repertory, in Murphy repertory also we can get rubrics like this. Stool after, if there is anxiety, we can think of multiple medicine it has been given, and arsenic, hydrastis, phosphorus, podophyllum, natrum phos, petroleum, phosphoric acid, sepia, veratrum, all this medicine we can think of. And in Bell's diarrhea also, we get such type of condition where there is a relation between mind and gut, right? So we can think of the medicine anger after, we can think of aconite, bryonia, chamomilla, epica, nux vomica, and mortification with indignation, we can think of epica. Now, Kent repertory, this we already know, and I guess we use this frequently also. This medicine we use frequently also. Just recapitulate for everyone that if there is diarrhea because of excitement, right, we can think of argentum, use it, gelsemium, phosphoric acid, Cuza, and if there is diarrhea, after exciting news, from exciting news, we can think of gelsemium. And for these symptoms, right, that diarrhea after from exciting news, I would like to share one of my experience also, right? It was during our college days. What happened that one of my friend, she cleared UPSC, right? And what happened after a few hours, or I can say a few 4 5 hours after, she started feeling upset in her gut, and she suffered from diarrhea. So we thought it's just normally it will get over by tomorrow. But what happened? It continued for 2 days. So it continued for 2 days. 2 days she was suffering from diarrhea. So we consult with one of our teacher, and he asked what happened, and from there he gave Gelsemium 30 to her, and it was like 33 dose he gave, and the next morning she was perfectly fine. So that was one of our conclusion. I can say that because of the exciting news was the cracking the UPSC, right? And that because of that she was feeling like she suffered from diarrhea, and in that case the Gelsemium, it has proved a very good effect. So if apart from this, if there is diarrhea uh, after fright, we can again think of Gelsemium, Argentum nitricum, Calcarea fos, opium, pulsatilla, right? If there is a diarrhea from exalted feeling, right, we can think of Argentum nitricum, diarrhea from indignation, we can think of colocynth, epica, staph, right? And if there is a constipation after vexation, so we can think of medicines like rhinia, nux vomica, and staph. So the main purpose of showing the different repertories is that apart from the regular medicine we use, we can think of all the medicine where we can find the beneficial effect of it also. And this will help us to add many medicine to our list also for treating such cases. Now, I would like to draw everyone attention like regarding the bowel nosodes. Like in such condition, even we can use bowel nosodes also. As this bowel nosode, it is made from bowel flora, we know, and it is mainly we potentize it and we gave it. It is basically a non-lactose fermenting colonies. It is made from it, and we know there is a very good work of Back, Peterson on this bowel nodules. Even though it was not proved on the healthy human beings, the proving was done on the sick patient, right? But they have shown beneficial effects of the bowel nodules on different conditions. They have even this they have proved they have done a stool culture of around 20,000 patients, right? And they have found the beneficial effects of this bowel nosodes, right? So I just want everyone to say that in such situations that we can even think of bowel nosodes, right? And we can see whether it is beneficial or not. So if we'll see the bowel nosodes, right? All the bowel nosodes, mostly all the bowel nosodes, right? The keynote symptoms is basically either from a mental plane or a GI plane. So we can see out here that for Morgan, the keynote symptom is congestion. For Proteus, the keynote symptom is brainstorm, right? For Gartner, the keynote symptoms is malnutrition. For Bacillus, we have mental and physical fatigue. For dysenteric compound, we have nervous tension. For psychotic compound, we have irritability. So bowel nosode, as it is made from bowel flora, so it have a connection. Both we can produce even mind symptoms also, and apart from that, gut symptoms also. So if we'll see these bowel nosodes and non-bowel nosodes or non-conventional, that is proved as per the Hahnemannian method of proving, I will say, this medicine which is proved on the healthy proving, there are some medicine which they closely relate with each other. For example, Morgan, right? Morgan pure. It closely relate with sulfur, calcarea, meadow. Morgan Gardner, it relates with Lycopodium. Lachesis, Sanguinaria. Proteus, it relates with Natramure. Sickly cord, right? Sickle cord. Apis, Mutabile, it closely relates with Pulsatilla. Bacillus number 7, it closely relates with Brynia. Calicarp and Iodum. Gardner, it relates with, the symptoms are somehow similar. Morph Silesia, Phosphorus, dysenteric compound to arsenic album, psychotic compound to Thuza, and fecalis to sepia. So what we can do if we are thinking, if the case is if we are thinking what to do, or if we are confused, so we can even think of the bowel nosodes also, right? And this bowel nosodes, we can prescribe it as constitutional, I can say, and plus we can prescribe it as an intercurrent also. There is a book, yes, we everyone know there is a book of bowel nosodes by that an update on bowel nosodes with comparison by Chaturgupta Nayak, where he had given nicely, where he had compared the bowel nosodes, right? Bowel nosodes with the closely related medicine, their similar features, their differentiating features. So that can be helpful to us, right? So next, I would like to discuss one of my case where I have given bowel nosodes only, which has proven a beneficial effect, right? So it was a case of chronic gastroenteritis. It was a case of chronic gastroenteritis. The female, she came up with the symptoms like bad taste in mouth, halitosis, flatulency, loss of appetite for 3 years. The treatment what she had taken was modern medicine, and plus she had taken homeopathic treatment also, right? In past history, she suffered from skin disease, right? And it was treated by homeopathic medicine. And if I'll talk regarding the personal history, right? She was a homemaker, irregular diet. The diet was irregular, right? And what I found in intrauterine history, that she was a C-section. So these things, even C-section, there was an institutional delivery, that is C-section. So this is also I can think, or I can correlate that the person who is under C-section, they tend to suffer from GI disorders, right? The physical, in generalities, there was like she easily used to catch cold, thermal reaction was hot, her appearance was thin built, pale, dark hair, dark complexion. Canine hunger was there. Desire for sweet was there. Salty food was there. Meat, egg, hot food was there. Aversion to egg was there. Butter was there. Fat was there. Aversion to. Tongue was dirty. Stool was mostly constipated. Right? Perspiration was there. Perspiration was there. There was a profuse perspiration, mainly on palms and sole. Sleep, it was insomnia, like the sleep was not good, right? And after all this, even mental pain also, she was irritable, quickly tempered, afraid of crowd, afraid of company, claustrophobic, weeping disposition was there, anxiety about her health, fear of darkness was there, all of things was there. So after analyzing the case, right, after analyzing the case was giving a picture of sulfur. I can say it was giving a picture of sulfur. So what I found, the lady, the female, she had already taken sulfur 1.5 months ago, and it was around 1.5 to 2 months ago, and she had taken 2 doses of sulfur 200, and there was not good effect, was not so much effective. So what I thought of giving a bowel nosode, and I gave her Morgan Pure. The reason I gave her Morgan Pure was the symptoms which was in coverage with which was under the Morgan Pure. And another reason was it was one of my assignments during on bowel nosode. It was one of my assignments on bowel nosodes also. So this was the reason I gave uh, Morgan Pure to her. I gave 2 doses of Morgan Pure, right? 202 doses. And in follow-up, I can say there was a marked improvement after giving Morgan Pure. She was improving. She was improving. Her generalities was also improving. Her particular symptoms was also improving, right? But after 2 and 2.5 months, what happened? The case was like stuck. It was same as before. Then and again, I repeated Morgan Pure 1 one dose, and continually she is in placebo. She was in placebo, and she was feeling good. So this was one of my experience with the bowel movements, right?
Okay, madam, it's really a very good session because we have just 4 minutes to finish the
Okay, sir. Okay.
session. So we will have to conclude. Of course, you can have another session in the coming month if you possible, so that we can have much more discussion about the
Okay, sir.
subject because it's a very, very good subject, and you have covered almost all part of the session itself, the mind gut relation connection, a homeopathic approach of to well-being. That is something great because the mind is always that's why Dr. Hahnemann started this kind of theory, but nobody could believe that such things can happen with the case taking. The mind is the biggest villain in all cases, and if you get the right thing about the mind, the right cause of the illness, definitely you will be able to click the disease in a short time. As you pointed out in the last part, that when a medicine action become a standstill, of course, then you can go this Morgan
Yes, sir.
like beautiful presentations. Definitely, we need some more presentation in the future also, because there is another session is coming shortly. I invite. Shall I close it? Of course, we will have to discuss about all those diet and regimen and everything.
Yes, sir.
But
Just
since the
it
lack of
was just
time,
1, 2 slides only, sir. It's okay, but just I was about to say regarding how we can improve our gut via probiotic foods. Okay, sir, no issues.
okay. Of course, we can have some more case presentation in the future, and in during the time we can have a discussion about the same also. So,
Okay, sir.
I invite Dr. Muhammad Zadan and to have a chat. You can ask the question to our friend Dr. RANJITA GUPTA. Yes.
Am I audible, please?
Yes. Short time.
Thank you, ma'am, very much. It is very interesting topic, and you have dealt with the subject from homeopathy point of view. The question is the slide of fear, anger, sadness, and the resultants of that on the gastrointestinal system. Did you find that applicable in your clinic on the patients? Did you find that exact? What did you introduce? Yeah, for fear you have diarrhea or constipation. Is it a fact? Did you find that a fact?
Sir, not exactly same. Sometimes in fear we find diarrhea and constipation also. But what normally physiology, like normal reaction, what it says that if there is a fear, the person they will have vomiting and like they will have a diarrhea. This I have taken from the book of Emmanuel Emanuel's, right, for the gut and brain connection. But in clinics, we tend to get such type of symptoms also, right? Not in clinics, even if we are going from examination, if there is a fear, yes, we used to suffer this type of symptoms, sir. So even I shared that regarding one of the fact of gelsemium, that one of my friend, because of exciting news, she suffered from diarrhea. So, sir, this is
Yes,
also, I can say, that
yes.
yes, there is a mind and brain connection. Because of fear there is a production like symptoms.
Definitely, Dr. Ranjita Gupta will be presenting one more presentation in the next month. During that time, we can have more time dedicated to discussion so that you can ask all questions and you can clear your doubt. And definitely, tomorrow we will have a presentation at the same time from Dr. Prashant Novel, Associate Professor Department of Organon from Gujarat. He is also coming from Gujarat, and the subject is a very, very interesting one. Dr. Samuel Hahnemann, the story we know more, man we know less about. So that will be the presentation tomorrow. With that, we come to the end of the session. We thank, on behalf of International Forum for Promoting Homeopathy, as well as on my behalf and those who participate in the session, we are thanking you, Dr. RANJITA GUPTA, for your excellent presentation this night.
Thank you for the appreciation, sir.
And once again, thanks all the participants who attended the session. And thank you all. Good night. See you at the same time. We will have another session coming on. Dr. Manoj will be moderating the Malayalam session. Thank you all. Good night.